Hello, this is Evelyn with Evie Stars, co-founder of Evie's Creations, and today I have my hubby joining me. I know the last couple of vlogs have been solo, but we decided to come and say hello and talk to everybody. We hope that everybody's doing well and keeping safe during these crazy times where nobody knows what's going on and what to do. It is definitely has been an eye-opener as to how one thing comes and can really just change your life overnight almost. And so it's just very scary, I feel, for a lot of people. It's very challenging to know what to do next and how to prepare for this. And I don't know, what do you think about everything that's going on?
I'm not even sure how to answer the question. I know that everyone says to self-isolate, right?
Yep.
But I'm not sure that we have much more information than that.
Yeah.
As far as I know, although they're working on a vaccine, no one has given any real positive feedback to say we think we have a way to solve it. Mm-hmm. So what they've done is they've taken medicines that already exist, mm-hmm. and they're hoping that will work. And I think that's great, and that's perfect. But it would be nice to hear that they found something, they just need to test it. I'm not sure I've heard that.
No, I haven't heard that either, actually. The biggest thing that I'm sure you guys have heard, and I've heard because I am a nurse, so I'm in the healthcare. And it's pretty much just keeping yourself clean, washing your hands, staying away from people. And we tell people over and over again, social distancing. And a lot of people are like, what exactly is social distancing? Especially if that's a new term for you. And social distancing is just that. It's just staying away from people. And it's just, like I said, it's just staying home when you can. It's going outside to go to your doctor's appointment if you need to, go shopping, get what you need to get, and come home. Washing your hands is a huge thing. Wiping surfaces is a huge thing to help prevent the spread. I mean, the goal, from what my understanding is just to stop the spreading of it, because the more people getting infected, then it's the more days that they're sick, the more days of, some people are even sick and they don't even have symptoms. So it's like you could be sick for up to 14 days, hold that virus in you, then get sick, and be able to pass it on to other people. So the goal is to stay home, to stay healthy, to stay away from people, and do your best in that. And that's hard to hear, because I want to speak for other people. I want to hear that they found something. I want to hear that there's a cure. I want to hear that everybody's going to be okay. And I feel like not having that validity that something is going to be all right is super scary, especially if this is something that I feel we've never dealt with, or at least our generation hasn't dealt with.
I would feel better if somebody said, we have a way to curb this, we have a vaccine, and it's going to take 6 months to develop. Mm-hmm. Although that's not the most ideal news, mm-hmm. but at least we have a direction.
Yeah.
And we just have to bear down and wait. Mm-hmm. That's not even a thing.
No, it's not. I haven't heard anything of that. I mean, I'm grateful and thankful for whatever stimulus package they're going to do, and the fact that they're getting more ventilators for hospitals, more masks for hospitals. I mean, all of that is super helpful, but the scary part is just, what's going to be next. And so I don't know what we do for that.
Yeah, the stimulus package, and I don't know much about it, but I'm just talking about broad strokes, mm-hmm. is, although they passed it and it's great, none of us has felt the effects of that yet, but a stimulus package was sent out without the coronavirus even being curbed. So we don't know how much worse this is going to be, whether this stimulus package is even going to be enough, which is terrible to say, because it's $2 trillion. It's a big number.
Yeah.
So right now it seems as they're just throwing money at something, but it doesn't seem to be very coherent. So if somebody knows different, I would love to hear it, but I'm not so sure anyone really knows what's after this.
But right there is the key word. I think that nobody knows what to do. So we're just trying to do anything pretty much to keep our, the U.S., keep it going, keep our economy going, keep people employed the best that we can. I think we're just trying to do as much as we can to help everybody. And it's just so challenging because you're trying to help in a situation that you don't even know how to help. You don't even begin to know what to do that's right. Besides covering your mouth, washing your hands, that's all we really know about it, and it's scary.
We're not hoarders. We don't go out and buy a bunch of toilet paper. We didn't do any of those things. But we're kind of running a little low. So, we got up this morning. We went to Costco. That was an act of Congress. I didn't want to leave the house.
You never want to leave the house, so you're good. You're constantly social isolated. Shit. The problem is that when I come home from work, he looks at me like I have the plague. He's like, don't touch me, don't hug me, don't look at me. Just go wash yourself off. Go disinfect, because he's chilling. He's at home. He's chilling. Works from home, so he's fine.
So we went to Costco. And the line, I'm very, very sincere, was around the block, the equivalent to being around the block.
Yeah.
So I was like, oh hell no, this is Arizona, it's getting hot, there's no way. So clearly somebody forced me to go.
Yeah, we need toilet paper, man.
So the line went faster than we thought, which was nice. And so we go in and out. Costco wasn't empty, but based on how I'm used to seeing it jam-packed, this place was a graveyard because they were limiting how many people were going in.
Yeah.
So there was lots of space. It was a very good experience.
It was a good experience, but it was a strange experience in my opinion because it's the first time that I've seen, you see all the workers who are gathering the carts all with gloves, some of them wearing masks, some of them not wearing masks. Then as you're entering Costco, you see this employee spraying all the handles with a disinfectant. And then another person coming through and wiping them through. And you go to show your receipt when you leave Costco. And the person's like, I'm not allowed to even touch your receipt. So they just kind of look for a certain number or whatever. And then they put their little line and sign it that, it was the correct date, the correct receipt, making sure we're not robbing Costco of the paper towels and toilet paper. But it was just interesting, not only the staff, but you look at everybody walking in there. Some people with masks, some people without masks, some people with gloves. And the thing with gloves, if you see some of the information that's out there, it's great. I feel that the person clearly, we all don't know what's going on, right? So we're scared. But that virus can live on the glove. The best thing for you to do is just wash your hands, wash your hands, wash your hands. But you'll see people touching everything with their gloves, touching handles with their gloves, not disinfecting themselves, just using these gloves, not realizing that these gloves can spread the infection. But I think that, you can't, I guess it's hard, you want to educate people, but at the same time, you can't go to a total stranger and be like, hey, take off your gloves because you're infecting everything. Look at you like you're stupid.
The only reason why I know that is because you do it for a living. So I have a feeling they just don't know.
Yeah, and I'm not going to tell them, excuse me. I mean, you want to tell them, but God forbid you insult somebody or touch them and come in like 6 feet of them to be like, hey, you may want to just take off your gloves because they're probably, holding all this bacteria, infection, whatever, not bacteria, but all this germs or whatever, and then just throw those out and wash your hands. And so it's scary. Like he had to blow his nose in there. I'm like, don't touch your damn face. Don't touch your face.
So there's a couple of takeaways. One, we didn't get fucking toilet paper.
No, we didn't.
We did buy paper towels as worst case scenario, but people still hoarding that. There was water. I don't think there was a limit on water.
There wasn't a limit on water. There was a limit on Tylenol, so we were able to buy 1 bottle of Tylenol, and then that was it. Paper towels, the limit was 2.
A big bottle of Tylenol.
Yeah, we got a big bottle of Tylenol, which we're hopefully, knock on wood, we don't need that Tylenol, but we do have it. Because then you hear the stories that ibuprofen is bad, and I'm like, drink ibuprofen for every ache and pain kind of thing, so now I don't know what to do, right? Paper towels, which will be our toilet paper if needed, we could buy 2. That was it.
That was it?
That was the limit on that. But yeah, I told him, he coughed in public. I'm like, don't freaking cough.
So before we get to that part, so everyone right now still has all their wits with them, right? So there's no panic or anything. So everyone was really, really nice. The customers, the staff. On any other day, if this wasn't going on, everybody would be flipping rude. It wasn't like that at all.
No,
at least my experience.
No, it was real nice.
Really nice.
It was, everybody was getting what they needed.
So I have allergies. I'm allergic
to life.
To life.
You're allergic to everything. You're allergic to life.
So we're leaving, and I have to sneeze. You know when you have that, you start making that movement with your mouth and your face, like something's got to come out. She looks at me, don't you dare, because these fuckers will knock you down the bed.
I'm like, don't sneeze, bitch.
And
don't sneeze.
They'll hog tie you so that you don't move. So you have to see me going to the store like.
And then he's like, I gotta blow my nose. I'm like, no, you don't, because here's what's gonna happen. You're gonna touch that tissue with your dirty ass hands and give us all the corona in our house. And we don't want that. So I'm like, you wait. So he's like sniffling all the whole like hour that we're in there, he's sniffling. I'm like, that's your problem, man. No, you're not touching your face with it. And so it's just interesting on how, like, you know, even me being in healthcare, as much as I have information, you know, you have information, but you don't. So you're just worried because you just want to protect yourself as much as you can in public. And then, like I told him earlier, like I said, we didn't go and like do the hoarding in the beginning and get all the milk and get all the soda and get all the, you know, paper products. We didn't do any of that.
To be fair to anyone who does do it, we don't have a family.
No, we don't have a family. We don't have kids.
It's just us.
And the dogs.
And we're pretty self-sufficient. We know how to hunker down. We know how to hunker down if we needed to. So that's part of the reason why we didn't do it, and two, we're not hoarders anyway.
Yeah, but I also think is that at the beginning we didn't really know how serious it was, and so then we started. I come home and I'm like, you know, telling him about the stories at work. I'm like, people can't find toilet paper, people can't find milk for their kids, people can't find all the necessities that they need. I'm like, now this is concerning. And then he's like trying to ask me to do a game plan. Well, how much food do we have in this house? Do we have a week or 3 weeks or something? I'm like, I have no freaking idea like how long this shit's gonna last.
Last week we were talking about MREs.
Yeah, I'm like, I don't know. I spoke to my friend. She was like, don't eat those. You'll be constipated forever. You won't need the toilet paper.
For those that don't know what MREs are, those are what the military uses. It's food that will, I say this as a hyperbole, so, you know, it will last a nuclear blast kind of food. And that's actually the conversation we had a couple of weeks ago, and then we kind of just snapped out of it and just went through life the way we are. Yeah,
I'm just like, listen, I know I can make top ramen, I can make rice. There's definitely stuff that I can create and make that will last in the cupboards. But with all of that being said, I must say, with the group of people that I work with, I have seen such a huge community of everybody trying to help each other out. It's really humbling, if you will say that, like, I don't know, you'll see we have like group chats, and we'll have like, you know, the emergency department in my job made a poster board. Like if you need something, a person will say if they have extra of a certain supply, have their number down. And if somebody else needs that product, they can just reach out to that employee to figure out a date on how they can pick it up. I mean, you have people looking out for milk for one another, people looking for, you know, toiletry items, for vitamins, for Similac. I mean, you see people just sharing all of the supplies that they have with each other to help each other out, to be like just a family. And it's just so amazing to see how everybody is coming together. Well, at least the people that I see. And you hear the news all over the world and people creating masks, and I mean, just the unity, the family, the community coming together. And it's just a beautiful thing to see. I mean, God, one of the girls at work gave me milk. Another one went and bought 2 gallons of milk because somebody couldn't find it for her kids. So it's just amazing to see this.
Somebody at your job got us water?
So yeah, they got us water. Someone brought fruit in.
And it wasn't a communication to just her. It was like a blast to people she knew.
Yeah.
Or they knew. I don't know if it was a woman.
And like if I go in the supermarket and if I see like milk or something that another person needs, I mean, it goes to the point, like one of the girls that I work with, actually, her kids are older, and so she ran out of milk. But instead of buying milk, like she bought like the almond milk and the coconut milk. And she told her kids, she was like, you know what, you guys don't need milk. You guys can deal with the almond milk. Let's leave this in the store for somebody else who may need this regular milk for like a kid who's like 2 or 3 years old. And I just find that just something amazing to look at and to really appreciate. And if anything with this virus, I just feel like, I mean, we always, I don't know, I'm the type of person like, why is this happening? What's going on now? And I don't know, you hear around there that, you know, maybe we're all into our own selves and we're all into our world, and we all are, like, we're all guilty of wanting more and not being happy with what it is that we have. I mean, I think everybody's guilty of this. It's not just one person. And now it's like, Jesus, I wish that I had like the bare necessities. You want food, you want milk, you want shelter, you want to know that you're going to get your hours at work and that you're not going to bring illness to your family. So it's just almost like bringing us back, if you will, to like what is truly important in life, and maybe it's like a reboot that was needed in the world. I mean, not to say that people need to die or that this needed to happen, but in a world that we don't know what caused this and how to fix it, it's almost like you have to try to look at it in a way that's almost positive, because there's so much negative that I feel like you almost want to lose your mind. Yeah, you know what I mean?
Evelyn and I, we started talking about worst case scenarios, not about death, just, you know, what food we have and that kind of stuff. And it was maybe the first 5 minutes we realized that we are one of the very fortunate few. Yeah. We're able to sustain ourselves, and we hear the stories on the news. And it's pretty bad, actually. It's only been, what, 3 weeks?
2 or 3 weeks. I mean, I don't know how much, I don't know. I honestly don't know how long the stories about what's been going on has been going on, right? But I think I've tuned in the last 2 or 3 weeks because I'm realizing that this is not something that's going away. We
were just very thankful to realize that even though we're concerned about ourselves, as everyone should be concerned about themselves, we realized very quickly that we're very fortunate. Yeah, and our conversation changed a little bit after that. We got a little more humble to realize that not many are in the shoes that we're in.
Definitely, and I don't know, I just say this, you know, be grateful for what it is that you have, and, you know, just be grateful for your health, be grateful for your friends, your family, those that are near and dear to you. But with that being said, just make sure that you just keep yourself safe, everybody. Just isolate yourself when you can. You know, I know it sucks being home. I'm stuck home with this dude, and I'm like, oh my God, just fucking shoot me. But I'd rather be stuck with him. I mean, well, sometimes I'm like, fuck, let me go out there and get sick because I got to deal with this. But no. No, I'm kidding. But shit, like, stay home. Like, it's boring sometimes, but just stay home. Wash your hands, wash your face. But I don't know, I guess use this as a time, or we could all use this as a time to remember what is important in life. You know, once this passes, because I have faith that this is something that will definitely pass and we'll learn more about it, that we continue that mindset of helping others out when we can, and that whole, like, just community, if you will. You know?
I like to think we're taking this seriously. We clearly do. You deal with this every day. You're seeing it.
It's scary.
Every day you go to work.
Yeah.
But there's a lot of people that not only aren't understanding the magnitude, but they're making pranks about it. So there was a story on a lady, I think it was Pennsylvania, New Jersey, where she went into a mom and pop supermarket, it wasn't a franchise, and pretended to have corona and sneezed and spit on produce, the food.
Oh my gosh.
I mean, it was, I can't fathom that. They had to throw away a mom and pop shop. So it's not a franchise. $35,000 worth of food.
Oh my God.
Because no one knew whether she really had it or not.
You don't do that during these. That's terrible. You don't do that ever, but especially now.
And when she got arrested, it was a prank. No, please don't arrest me because it was all fake. No, I'm sorry.
Yeah, no, you're getting arrested.
You're getting arrested.
Because you're an idiot.
Yeah,
like, don't do that shit.
What the fuck's wrong with you?
Yeah, no. You see, it's stuff like that. It's like, what the hell? During times like this, you see how serious it is. And you're gonna.
There was another story. A bunch of kids did a party. They ignored the quarantine thing. So they had a, I don't know, defiant party that we don't care if getting coronavirus or not. Turns out one of them did get it.
Oh shit, yeah. Well, that's what they get, and they got it, and they probably spread it to all their friends, and then their friends' family, and people don't realize that it just doesn't affect you. Like, if you think you're invincible and you're not gonna get this, that's crap. And you're like, oh, I'm not gonna spread it to people. You're the one that can spread it not only to your friends, you're spreading it to their loved ones, and you don't know who's immunocompromised, who's older, whatever, and those people have a harder time fighting this. I mean, you have young, healthy people that are having a hard time fighting this. So imagine that population. This is not a joke. It's not funny, and so. What to take home from this talk?
There is a worst case scenario thing that's going on in the news, and I think it just started a couple of days ago, where 20% of the population of the United States could be affected. Whether they pass away or not was not the issue. Is that 20% could get it, and that may not seem like a big number. It is, by the way. It's huge. But 20% of our population will cripple our country for years to come.
Yeah.
Because the economy will go to the tank, and people aren't thinking of that.
They're not thinking of that at all. I think it's time for, if we could say anything, is take this seriously. Take it seriously. Protect yourself, your friends, your family. Just know that we don't know what's going to happen. We don't know what the next steps are going to be. And, just one day at a time and go from there. I just have faith that this too shall pass. We just don't know when and how, but this too shall pass.
Yeah. It is easy to say, everyone says, just hunker down. It can be frightening.
Absolutely. It's hard to think about that. You have a lot of people now, they've lost their jobs and don't know what's going to happen the next week. You're talking about that this may happen, this may be around for a couple of months now, to come. I don't know how long they're saying, but for someone who just lost their job and they're already struggling, that is an eternity away, and it's just so scary. It's so scary.
I'm assuming everyone knows who Bill Gates is. He's the founder of Microsoft. And he's arguably one of the leading experts in the world in fighting diseases, because he has the Melinda Gates Foundation. So there's two things. One, he did a speech 4 years ago. I mean, everything's hindsight 2020, right? 4 years ago, and he said that the United States is not prepared for something like this, which he turned out to be right. Mm-hmm. And he was recently interviewed, and he kind of broke it down in really plain English, and he said, if you really want to get rid of this, you have to do a forced countrywide quarantine for like 10 weeks.
And that's a lot to think about.
This guy knows what he's talking about. 10 weeks. Can you imagine the entire country for 10 weeks?
The hard part is that you have, to think about having to do these forced quarantines. This wouldn't be necessary if people would just stay home when they can. Clearly, some people, you got to go to work, you got to go to the supermarket, there's shit you got to do. But to go and just, party or go outside or go do whatever in these groups is like, no, just stay home. Let the virus die off. It's a virus. It has to die off. Right now we have no vaccines for it. We're trying out medications, hoping that it will work. Stay home. Why does somebody have to force you to stay home instead of just you being like, what, this is serious. I see the numbers. I see people are dying. Let me stay home. I don't get it.
But at Costco, people were buying massive bottles of vodka.
Yeah, people were buying vodka, liquor,
almost to drown themselves.
To drown themselves from this, yeah.
And that's an issue.
Yeah, it was scary.
It's really an issue.
See people taking 2 or 3 things of vodka.
Massive bottles of vodka.
And they're like, oh, well, there's no limit on this, and joke around, but it's like you see that people are afraid, and it's like, what? Let me just drown out these sorrows, not think about anything, get drunk, pass out, whatever. And it's the reality of the times that we're in, and so it's just, I don't know. The take home from this is just stay home and take care of yourself, and I have faith that this will pass.
So 2 weeks ago, although we knew this was an issue, since they've been talking about it, but 2 weeks ago we kind of, got a little serious about it. We were like, well, let's just leave town. We'll go to the mountains, stay there a week or so. We'll come back. And we didn't realize Corona wasn't going to go away in a week.
Yeah, no, it wasn't.
And so, we're having this conversation, and then it's kind of hitting us like a week doesn't mean anything. Leaving and just staying away, it's going to be weeks and months.
It's going to be weeks and months, and then we would have been in the middle of nowhere.
And not know.
And not know what's going on. Oh, we come back like, yeah, it's gone. And like, wait a minute, we had no news, no television, but, you know, thinking about it, though, it's just like ignorance is bliss almost. I used to never look at the news. I never watched the news. I'm like, I don't know, the world's all messed up. Like, why do I want to be more depressed? Let me just not know anything. And now, as this is going on, I'm glued to the news, and I'm like, God, I wish I was just the way I used to be and not know anything anymore, because it's scary. It's scary to know what's going on. It's scary to know that there's no, it almost seems like there's no end yet, or like there's no, what am I trying to say? Just there's
light?
No light at the end of the tunnel, so to speak. It just seems like it's just not there yet, and I'm just looking for something, even if, like you said,
a definitive thing.
something. Well, I did become hopeful when they're like they're Plaquenil or these other medications that are used for something else may be beneficial for COVID. I'm like, well, then this will be good, you know, hopefully. So that has me hopeful, but I'm still scared, you know.
Today we kind of made fun of the news cycle. You got important people in the news, you know, and we realized that in the first 5 minutes, they were talking in circles.
Because nobody knows what's going on.
No one knows what's going on. So instead of admitting, like, we have no idea what the hell it's talking about, we're just looking to fill time because, you know, we have a TV station to go, it was kind of depressing.
It was, because it's like they're asking, you know, these people that are with the CDC, they're asking people in government, they're asking people in the economy or whatever, financial advisors, all this stuff. Oh, how long you think it's gonna last? It's gonna be 2 weeks. Oh, do you think this is really gonna? How long do you think this stimulus package is gonna last? It's gonna last for like 2 months, 3 months, and they're all like,
Who cares?
I don't
we just
know.
gotta stop it.
We have no idea. Like, we need to stop it, and we don't know what's to stop it. We don't think that we've hit our peak, you know. Then you hear the numbers going up, up, up. But in me, like as a healthcare person, right, and my fellow healthcare people will agree, it's like, I'm like, well, of course the numbers are going up because we're looking for it. We're finally testing for it. So obviously the numbers are going to go up. We really don't know how long this was going on before that, you know. I mean, you test for something, you're going to find it.
You know, it's not a popular comment that I'll make, but New York is leading in coronavirus infections.
Yeah. Gosh.
My
yeah.
question is why?
Yeah. Well, you know, you'll hear that it's a small state compared to other states. But it's highly populated. Everybody lives on top of each other.
But Chicago's populated too.
Yeah, but I don't know. I really don't know
No,
the
I know.
comparison between the both.
And I think that's my question. What's so different? I know New York is the hub for, you know, the stock market. It has an international airport. You know, people. You know, but you still should ask the question: why are they more than double than any other state? What is a common denominator there? Are we not doing something we should be? Are the politicians afraid of something? So I started asking that question, I think yesterday.
Yeah, and there's no answer for you. So you're going to ask a question that will never have an answer. Well, at least now won't have an answer. Yeah. But I'm just wondering why. You know, you could say, oh, it's overcrowded. It's already highly polluted. Just, you know, and it's a droplet. What is it? It's just air. It lives on surface. The COVID lives on surfaces. You have to wear masks to protect yourself, and everybody's breathing on each other and on top of each other. Well, it'll spread easily, you know. And you have also, like, right, sometimes in New York, they'll say stay home, and you're like, no, I'm going out. You know what I mean?
I showed you a picture of Times Square.
Oh, that was crazy.
It was not only empty, but yet the coronavirus is still spreading. So how does that work?
Yeah, I don't know the answer. I don't know. It's hard. During these times, there'll be a lot of unknowns, which can be super frustrating. It definitely is. Yeah, well, anyways, we just wanted to check in and say hello, see how you guys are doing. Just remind you, stay home when you can. Wash your hands, wash your hands, wash your hands. If you have people in the hospital, remember, at least for now, I think there's a ban on visiting and all of that stuff. Don't come in with your mask and gloves that you've had on for like 3 days straight, not changing them, because you're just spreading it to everybody. I have to say that as a nurse, because it's frustrating when people are like, I came in, you see I'm protected. Well, yeah, you may feel like you're protected, but everything that's stuck to your mask and your gloves is like spreading things to everybody else. So stay home when you can and just spend the time that you can with your loved ones. And I don't know, I'm popping us full of vitamins and stuff. Not saying that that's going to help, but just try to keep your health up as much as you can. I'm going to keep giving you a whole bunch of crap. Anyways, we hope that you enjoyed this little talk and just self-quarantine. Try not to kill your spouses, families, children. I know a lot of people are homeschooling their kids, and I know that that's a challenge. Just stay strong, my friends. Stay strong. We'll get through this. If you like this show, be sure to give us a thumbs up. Don't forget to subscribe so you never miss an episode. I hope that next time we can share something a little bit more joyful. But until then, just stay safe and take care of each other. We thank you so much for tuning in. Take care. Say bye.
Bye-bye.
Bye.